Hey, Dr. Lindsey here. In this short video, I interview a 22-year-old young man. His mother's in the background. I asked her a question. You can hear her briefly, but he didn't want to show his face. And we did about 2,500 grafts on him 6 months and a couple of days ago. And here's his video. Hey, it's Dr. Lindsey here. I'm here with Steve, who doesn't want to show his face. Steve, you're 22, right?
Yep.
And you came with your mom, who's standing back here behind us, and you're such a good young man. I told you all the stuff to worry about starting this at a young age, right? I didn't try to talk you into any kind of nonsense.
Nope, not at all.
And so your before pictures are up between us, and going for you as we talked before, you got brown skin and black hair, and so it matches really well, and you got curly hair, which is like bushy hair, and so it covers better than somebody that's, say, Vietnamese with white skin and skinny black hairs and a big color contrast. But it's 6 months, they're like 6 months today, right? Or 6 months and a couple.
Yeah, a little over 6 months.
So bend your head over just a little bit. There you go. And I'm going to pull on your hair. None of that stuff was there before. You can take back. Okay. Any kind of bullshit I pulled on you?
No, not at all.
Mother, you say, did I any kind of nonsense I tried to talk you or your son into?
Amazing, beautiful, well done job.
Okay.
Thank you, doctor.
Keep your thing up there. Turn around. And that's good. Your scar is hard to find. Anybody notice that scar?
Nope, not at all.
Turn back around. How much did the whole thing hurt?
Barely any.
Okay.
Honestly, to me.
And we made you come every day to get cleaned, and it's kind of a pain in the butt to come up here from where you live, but it was okay.
It was the best experience.
Okay. And well, you're probably half growing now. I expect to see you back. It's just like July 18th today, sometime towards the end of January 26th, and we'll do one final video. But thank you so much for coming. You're a 22-year-old young man, and your hair, pull this down just a smidgen. And I give you a hairline that will age well, not some kind of goofy hairline that'll look silly when you're my age. Thank you so much.
Exactly. Thank you, Dr. Lindsey. The best.
All right. So to summarize, we do plenty of younger patients, but the key is, I think you need to younger patients, even though they're adults, make a better decision if they have their parents come with them to the consultation, and then come to the surgery. We give a hairline that will look okay as you get old, like me. Not everybody's going to stay young in their 20s forever. And so you have to have a hairline that will mature okay. And 3 is, many times, even if we do this today, and you're young or old, you might need a second or a third one of these. So plan for that and frugally spend those donor hairs. If we can help you, give us a call. Thank you.